Have you ever wondered how local anesthetics numb only a specific part of the body during minor surgeries? These specialized medications have a fascinating history and have evolved significantly over time. They work in unique ways to provide relief from pain during various procedures. How, why, and what are the different types and their uses? These are some of the intriguing questions we'll answer as we delve into the captivating world of local anesthetics. Stay tuned as we journey through the fascinating world of local anesthetics. The discovery of local anesthetics, like many medical breakthroughs, is quite an interesting story. Let's take a step back to the mid-19th century, a time when the world was rapidly changing and science was making great strides. In the year 1855, a significant turn of events took place. Cocaine, a naturally occurring substance found in the coca plant, was isolated for the very first time. It was no less than a revolution in the world of medicine. This discovery was a major turning point in the history of pain management. Cocaine was found to have remarkable numbing properties, and it didn't take long for the medical world to take notice. Fast forward to the year 1884, we see the first recorded use of cocaine as a local anesthetic. The man behind this groundbreaking application was Karl Koller, a name that still echoes in the corridors of medical history. Koller was an ophthalmologist, and he discovered that cocaine could be used to numb the eye for surgical procedures. This was a significant breakthrough, as eye surgery was notoriously painful and difficult to perform due to the sensitivity of the organ. Koller's discovery might seem like a small step today, but back then, it was nothing short of a giant leap. It completely transformed the way surgeries were conducted. Pain was no longer an inevitable part of surgical procedures. With the use of cocaine as a local anesthetic, patients could undergo surgeries without experiencing any pain. But the story doesn't end there. The discovery of cocaine's anesthetic properties sparked a wave of research and development that led to the creation of safer and more effective local anesthetics. It paved the way for the development of a whole new class of drugs that have become indispensable in modern medicine. So, from the discovery of cocaine, the journey of local anesthetics began. And what a journey it has been, changing the face of surgery and making what was once unbearable, bearable. Over time, the medical world has seen a significant evolution in the development of local anesthetics. Let's rewind the clock to the late 19th century when local anesthetics first made their mark. It was cocaine, an alkaloid extracted from coca leaves, that pioneered this journey. As the first local anesthetic, cocaine was a game changer, but its use was not without serious risks and side effects. Addiction, toxicity, and other health concerns made it clear that safer alternatives were needed. Fast forward to 1905, and we see the introduction of procaine, better known by its trade name, novocaine. Developed by a German chemist, Alfred Einhorn, procaine was synthesized as a safer alternative to cocaine. It was less potent, less toxic, and had a slower onset of action. Procaine revolutionized dentistry, making dental procedures less daunting for patients. But its slow onset and short duration of action meant that the quest for better local anesthetics was far from over. World War II brought about an urgent need for effective local anesthetics, and out of this necessity, lidocaine was born. Introduced in 1943, lidocaine was more potent and had a quicker onset of action than procaine. It became the gold standard for local anesthetics, and to this day, lidocaine remains a popular choice in a variety of medical procedures, from minor skin surgeries to dental work. But the evolution of local anesthetics didn't stop with lidocaine. The latter half of the 20th century saw the development of newer agents like bupivacaine, ropivacaine, and levobupivacaine. These anesthetics offered longer durations of action, making them ideal for procedures requiring prolonged pain relief. Bupivacaine, introduced in the 1960s, had an impressive duration of action, but its potential for cardiac toxicity raised concerns. This led to the development of ropivacaine in the 1990s. Ropivacaine offered a similar duration of action, but with a better safety profile, particularly in terms of cardiac toxicity. The most recent advancement in the evolution of local anesthetics is levobupivacaine, a newer agent developed in the early 21st century. Levobupivacaine is essentially a safer version of bupivacaine, offering comparable efficacy but with reduced potential for cardiac and neurological toxicity. The evolution of local anesthetics is a testament to the relentless pursuit of better medicine. Each new development has been a step forward, improving safety, efficacy, and patient comfort. But the journey doesn't end here. As we move forward, the quest for safer, more effective local anesthetics continues. Researchers are exploring novel approaches such as site-specific delivery and controlled release formulations to further enhance the efficacy and safety of local anesthetics. Indeed, the evolution of local anesthetics has been a journey of constant improvement. Now, one may wonder, how do these local anesthetics work? That's a fantastic question. The secret lies in their unique ability to block nerve conduction, effectively preventing the initiation and transmission of nerve impulses. To understand this, let's first delve into the basic structure of a nerve. A nerve is essentially a bundle of individual nerve fibers, each of which is responsible for transmitting electrical signals known as action potentials. These action potentials are generated by the movement of ions, particularly sodium ions, across the nerve cell membrane. This movement occurs via specialized structures called voltage-gated sodium channels. In a resting nerve fiber, these channels are closed. However, when an action potential begins, these channels open, allowing sodium ions to rush into the nerve cell. This influx of sodium changes the electrical potential of the cell, allowing the action potential to propagate along the nerve fiber. Now, this is where local anesthetics come into play. These drugs work by binding to the voltage-gated sodium channels in their inactive state, preventing them from opening. Without the influx of sodium ions, the electrical potential of the nerve cell cannot change, and thus an action potential cannot be generated or transmitted. This effectively numbs the area where the anesthetic was applied, as the nerves are unable to send signals of pain or sensation to the brain. But how do anesthetics know where to go? Well, they don't really. Local anesthetics are not selective for pain fibers. When applied, they block all types of nerve fibers in the area, including those responsible for pain, temperature, and touch. This is why, when a local anesthetic is used, you not only lose the sensation of pain, but also other sensations like temperature and touch. It's also important to note that local anesthetics don't work instantaneously. They need time to penetrate the nerve fibers and bind to the sodium channels. The onset of action can vary from a few seconds to several minutes, depending on the specific drug and the concentration used. Furthermore, the duration of action can vary greatly as well, ranging from half an hour to several hours. This depends on several factors, such as the type of local anesthetic used, its concentration, and whether or not it's combined with a vasoconstrictor, which can prolong the anesthetic's effect by reducing blood flow and slowing its removal from the site of administration. So, in a nutshell, local anesthetics work by blocking the transmission of nerve impulses, rendering the area numb and free of sensation. This fascinating mechanism of action is why local anesthetics have become such an invaluable tool in medicine, particularly in procedures where pain relief is needed, but patient consciousness is preferred. Understanding this mechanism is fundamental to appreciating the role of local anesthetics in medicine. Local anesthetics come in different forms and have a wide range of uses. Let's dive in to explore the various types of local anesthetics. First up, we have topical anesthetics. These are applied directly onto the skin or mucous membranes. They are often used in the form of creams, gels, sprays, or patches. Topical anesthetics are the go-to choice for minor procedures like skin biopsies, cannulation, and even for reducing the pain of needle sticks in children. Next, we have injectable anesthetics, which are injected directly into the body tissue. They are used in a variety of clinical settings, from dental procedures to minor surgeries. The most commonly used injectable anesthetics are lidocaine and bupivacaine. Lidocaine is often used in dental procedures and for numbing the skin before minor surgeries. Bupivacaine, on the other hand, has a longer duration of action and is used for procedures that require a longer period of anesthesia. Then there are local anesthetic solutions for nerve blocks. These are often used in surgical procedures to block pain signals from a specific region of the body. This type of anesthesia is commonly used in orthopedic procedures, such as knee and hip replacements, where it is important to control pain without affecting the patient's ability to move. Finally, we have local anesthetics in the form of ophthalmic drops, which are used to numb the surface of the eye for procedures like cataract surgery or for diagnostic purposes. Now, let's shift our focus to the different uses of local anesthetics. Besides the ones we've already discussed, local anesthetics play a crucial role in pain management. They are often used in chronic pain conditions, such as neuropathic pain and complex regional pain syndrome, to provide relief. Moreover, they are used in palliative care settings to manage pain in patients with terminal illnesses. In the realm of dermatology, local anesthetics are used in procedures such as mole removals, skin grafting, and even in the treatment of certain skin conditions like warts and skin tags. In the world of sports medicine, local anesthetics are sometimes used to manage pain during rehabilitation from injuries. They can provide temporary relief from pain, allowing athletes to participate in physical therapy and speed up their recovery process. In dentistry, local anesthetics are indispensable. They are used in a multitude of procedures, from simple tooth extractions to complex root canal treatments. Without local anesthetics, dental procedures would be a lot more unpleasant. Local anesthetics also find their use in diagnostic procedures. For instance, they are used in nerve conduction studies to help identify nerve damage, and in spinal taps to make the procedure more comfortable for the patient. Truly, the versatility of local anesthetics is impressive. From minor skin procedures to major surgeries, from pain management to palliative care, these medications play a critical role in healthcare. They allow doctors and surgeons to carry out their work effectively, and most importantly, they make patients' experiences a lot more bearable. Before we wrap up, let's summarize the key points we've discussed about local anesthetics. We've taken quite a journey diving into this fascinating field of pharmacology, and it's time to bring all those threads together into a coherent tapestry of understanding. We started our exploration with the discovery of local anesthetics, a pivotal event that marked a turning point in medical history. Cocaine, the first local anesthetic, was isolated in the mid-1800s from the leaves of the coca plant. This breakthrough paved the way for safer and more effective surgical procedures by providing a means to numb specific areas of the body, thus eliminating pain. From there, we charted the evolution of local anesthetics. We saw how the initial discovery of cocaine ignited a flurry of research and development that led to the creation of synthetic local anesthetics. These new drugs, like novocaine and lidocaine, brought improved safety profiles and efficacy, allowing for a wider range of applications in medical and dental procedures. Next, we delved into understanding how these remarkable drugs work. At their core, local anesthetics block nerve conduction by preventing the influx of sodium ions into nerve cells. This action inhibits the propagation of nerve impulses, essentially switching off the sensation of pain in the area where they are applied. We also discussed the various types and uses of local anesthetics: topical anesthetics for surface numbing, injectable types for deeper numbing, and even ophthalmic versions for eye procedures. We learned that local anesthetics are not just about pain relief in surgery. They're used in a multitude of settings, from childbirth to chronic pain management, demonstrating their versatility and indispensability in modern medicine. The importance of local anesthetics cannot be overstated. They've revolutionized medical practice, not just by allowing surgeons to operate without causing pain, but also by enabling a wide range of procedures to be carried out in outpatient settings. This has led to less hospitalization, faster recovery times, and improved patient comfort. But remember, like all drugs, local anesthetics are not without their risks and side effects. They require careful dosing and administration by trained professionals to ensure patient safety. Understanding their pharmacology is crucial for anyone involved in their use, from the doctors and nurses administering them to the researchers developing the next generation of these vital drugs. So there we have it, a whirlwind tour of local anesthetics, from their origins in the coca plant to their central role in contemporary medicine. It's a testament to the power of scientific discovery and innovation, and a reminder of the constant quest for better ways to alleviate human suffering. As we conclude, bear in mind that the world of pharmacology is vast and ever-evolving. The study of local anesthetics is just one piece of this intricate puzzle, but it's a piece that has brought relief and comfort to countless individuals across the globe. That wraps up our exploration of local anesthetics. Remember, the knowledge you gain today can be the anesthesia that numbs the pain of ignorance tomorrow.